Hello, everyone. It is about a minute away from the top of the hour. Just wanted to say welcome, and we will wait for others to join. Thanks. Okay, hi everyone, let's get started. My name is Lisa Collins and I am going to be presenting our webinar today. It's on ICHRA Solutions for your 5 common renewal challenges. But before we get into that, I just wanted to mention a couple things. We always get questions about getting the presentation and the recording. We absolutely will send that out to all the participants. You can review it later. And also, we're going to be speaking about some concepts, a lot of new concepts, and this is going to be very high level because of just the amount of time that we have. We do appreciate you joining. We understand that everybody is already so busy with the renewal season just starting. So we do want to take your questions. We do want to address questions that will come up with these new concepts. Because we're talking high level, not talking specific to your needs or your group needs, please post the questions in the question area, and we will get back with you after the webinar and make sure that we address any questions that you may have. So again, questions in the questions area, we're happy to answer them. We just have so many joining, we can't open it up just because of all the background noise that we would experience. So I'm just going to wait a couple more seconds here. I see the attendance quickly adding up here. And let's go ahead and get started. I'll just talk about what we're going to review today as we wait for the others to join. I'm going to talk about just some basics of ICHRA to start with. We do have a variance in the audience, some brokers that have worked with ICHRAs for some time now, some that have only worked with a couple, and then others that are completely new to the concept of ICHRA. So just want to get some groundwork, some baseline understanding, all on the same page before we actually talk about these 5 challenging renewals that we're hearing about from brokers and the discussions that we're having, how ICHRA could potentially help solve those renewal issues that they're having. And then we're going to end up with just very quickly showing you some of the tools that we have available to help make ICHRA deployment easy. And yes, it can be easy. So as we talk through the 5 challenges, we're going to talk about the issues, the causes of the issues, what's resulting from those issues, and then we're going to talk about where ICHRA could fit. And we do understand ICHRA is not always going to be a solution, but we are finding that brokers are surprised at how often it can be a solution. So there's, these tools that we're going to present will help you model various groups and really give you the tools to have a very strong conversation with your groups at renewal time if ICHRA is a fit and if it's not a fit. If it's not a fit, let them know that you've looked at it and it's not a fit because of this reason. Or if it is a fit, let's take a closer look at it and discuss what really ICHRA means for the employer. Okay, so getting back to some of the basics. So this has just been around since January 1st of 2020, and we all know we were preoccupied in 2020. There was discussion in 2020 about it, but now we're starting to see some pretty quick adoption with ICHRA solutions. Unlike, unlike the ICHRA market, which limited, it's been around longer, but it limited this type of individual market coverage under an HRA arrangement to small groups, groups under 50. So I'd like to say ICHRA is kind of like ICHRA's on steroids because it gives it so much more flexibility and options. ICHRA is really a shift from a defined benefit plan, so where the employer is deciding what group health plan or two to offer to their employees, to a defined contribution. So letting the employees choose their plan on the individual market, but the employer is going to define how much that they're going to contribute to that individual coverage. So it enables the employers and employees to use pre-tax dollars. So a really good tax advantage here to buy the individual medical coverages and also ancillary insurance as well. So as I said, it can be used for small groups, and we're defining small group as ACA does. Small group is less than 50 employees, and large group is 50 or more employees. So used for both small and large group. The beauty of it is you can structure it to really meet a small group's needs or a large group need. So for small group, you can actually leverage ACA subsidies. And you may kind of say to me, oh, that's why we were using ICHRA's. I didn't think ICHRA's you could have subsidies. We're going to show you a way that you can. So by using classes, which I'll define here in a minute, by using classes and making ICHRA unaffordable, so your ICHRA contribution unaffordable to certain classes of employees, it will open up the availability of those subsidies to those employees. So some pretty cool tools provided to you to let you have that conversation with your employers and see how much subsidy. I mean, with a subsidy expansion, subsidies can be pretty significant. So you don't want to put an employer at a disadvantage because you have this group health plan for lower paid employees that can't access the subsidies, or you don't want to put them at a disadvantage of offering an affordable ICHRA plan to everybody and not accessing those subsidies. So we'll get into that in a little bit more. And then we also have the large groups. So large groups, applicable large employers must comply with ACA. And ICHRA actually does comply with ACA mandates as long as it is considered an affordable ICHRA plan. And the affordability could be challenging to manage, but again, when we talk about the tools that we have available, I think you'll see how easily you can have a plan meeting those mandates and not setting up an employer to potentially have those penalties. ICHRAs can be deployed two ways. You can have full replacement of the group health plan, so terminate the group health plan and only offer ICHRA, or offer ICHRA to employers who have never had a health plan in the past. Or you can keep the group health plan and carve out or class out a particular group of employees, allowing them the ICHRA option, and the rest of the employees that haven't been put into that class, the group health plan option. So both the group health plan and ICHRA can be available. You can't make one employee, you can't give one employee the choice between group health plan or ICHRA. You have to class them out and only give them the one, either the group health plan or ICHRA. So ICHRA, at the end of the day, it's enabling that migration from the group market to the individual insurance market. As we go through these examples, we're going to show you and talk about how to manage renewals with an ICHRA solution, and a lot of times classes will come up. So let's define what classes mean here. There are 11 classes in the ICHRA regulations, and those 11 classes, you can actually do a combination of the classes to come up with new classes. But I'm going to only concentrate on a couple classes here that you'll see because these are the most common classes that are being utilized and the most effective in ICHRA. So you can have a combination of these classes as well. So full-time, part-time would be two different classes, or salary and hourly would be a class, or geographic location. For example, a state. You're going to class out employees in the state of Ohio, but the company is based in Virginia, as an example. As an example of the combination of classes, you could have in Ohio, your state, but have salary and hourly in Ohio. So there's your combination. There's one thing to note with these classes, though, and this is important. If you are still offering a group health plan, the common classes I mentioned above, they need to have group minimums. Okay, so if you've got an employer with less than 100 employees, the minimum class size is 10 employees. If you have a group that's between 100 and 200 employees, your class size needs to be, minimum class size needs to be 10% of the total number of employees. And then if you have a larger group, 100 or more employees, that minimum class size is 20. So easier, to reach that with larger groups. That's only if you have the group health plan. So if you terminate the group health plan and only offer ICHRA and you set up these classes, you don't have to worry about a minimum class size. I do want you to note, though, when we talk about a geographic location, if it's smaller than a state, like a county, a zip code, or a rating area, that's only when these minimums apply. So if you're classing out an entire state, that state of Ohio, then you don't have to worry about these minimum class sizes. I've had many conversations with brokers and they said, I don't think ICHRAs are going to be a fit because the individual market it's not good in my area. And yeah, I'm getting 2 people saying my audio is going in and out and hard to hear. I apologize for that. I don't know. Move a couple things around here and hopefully that will help. I don't know if it's my internet connection or what's going on. So concerns about the individual market. What we do see is an expansion in these markets. Open enrollments beginning November 1st, and for the 4th year in a row, we have seen expansion on the individual market. In 2022, United Healthcare is making inroads in 7 new states, and Aetna is moving into 8 states. I'm going to do something with my audio here real quick. Let me know, does that sound better to everybody? If somebody in the question area could just let me know if that helps or not. Let's see. That's more, okay. Sounds even, yes, okay, great. Thank you for letting me know that. So as I was saying that in the individual market, there's concerns brokers are saying it's not looking too good in my area. We sit on an HRA council and just different reading that I've done that I'm showing you here. We do see an expansion happening. For the 4th year in a row, we're seeing expansion in the individual market. United Healthcare is opening up new states, so is Aetna. And the carriers are wanting to return to the individual market because they're seeing a healthy population in the individual market. So where they may have gotten out before, they're getting back in. And it's stabilizing the premium pricing as well. So I want you to pay close attention to your individual market in your area, because maybe that perception that you have that the individual market's not real strong, you may see changes. So ICHRA really is driving the shift from group to the individual market. So let's talk about the 5 common renewal challenges and also talk about the ICHRA solutions. Because my audio was kind of going in and out, what I'll do is I'll kind of go back and talk about some of the areas that you may have missed. So go into a little bit more detail. So here's your first renewal challenge. The group has low participation. I'm sure you've been faced with this. And usually it's low participation because the bottom line is the premium is not affordable. The group doesn't meet the carrier's minimum because the employees just can't afford to participate in the group health plan. And the carrier has told you if you don't get up the participation and meet our requirements, the group policy is in jeopardy of potentially being terminated. Okay, so that's a tough spot to be in. And maybe you can't do anything with the cost shifting really to make that affordable for those employees. So the ICHRA solution in this case may be terminate the group health plan and offer ICHRA. So if you terminate the group health plan and you're offering ICHRA, you're only talking about individual coverage. And individual coverage, you do not have to meet those minimum participation requirements. So it would work, right? The ICHRA contributions can vary based on the employee classifications. So I'll go back to the classifications again because my voice was going in and out at that point. you can class out the most common classifications are hourly, salary, full-time, part-time, and geographic area. Those are, our top ones that we see that are most efficient. So you could class out hourly and salary as an example and have different contribution structures based on the hourly class and the salary class. For applicable large employers, though, you have to keep in mind you still have to meet affordability. So, that lowest silver plan, it's got to be affordable to the employee. You don't want to set up an ICHRA plan that's not affordable and then have the employer face those penalties. We'll show you how to do that. And then for the small employer, so low participation usually is, because it's not affordable, we're usually talking about a lower paid workforce. Okay, we're going to make that assumption there. If it's a small employer, let's set that ICHRA up to be unaffordable. So I'll kind of repeat that again too, because I spoke about that before. An ICHRA solution, if it is designed that the contributions for a particular class are unaffordable, it allows the employee to waive out of that ICHRA and take the subsidy. So let's go back to the hourly and salary example. I'll use a restaurant as an example. You've got your salary employees, they're managers. And then you have your hourly employees that are the wait staff and the cooks and so forth. We can class out salary and hourly, and the salary people make too much money. There's no subsidies there. So there is an ICHRA plan that the employer is helping to reimburse some of that premium on their individual market coverage selection. And then for the hourly employees that are usually the lower wage income employees, they have unaffordable ICHRA. And because it's unaffordable, they can say, I don't want the ICHRA, I want the subsidy. And we have almost always seen that the subsidies are greater than what the ICHRA employer amount will be. So they waive out of the ICHRA, and that now they have all the subsidies available to them, especially with the subsidy expansion. That can be pretty significant. So you're designing a plan that's affordable for one class and unaffordable for another class. Moving on to the next common one. I'm just going to check my questions. Yeah, so I said in the beginning, and again, I apologize, you couldn't hear me well. I will send out the presentation. We will also be sending out the recording. There's a lot of new concepts here. We are going just high level because we have a very short period of time with you today, and we do appreciate your time, and we know you're very busy. So please put your questions in the question area, all your questions. We will get back to you at the end of the presentation and answer all the questions that you have. So renewal challenge, remote workers, that's your next one. This is coming up more and more. Many employers have discovered that they can have remote workers and it works effectively. And some employers are even realizing that it opens up their candidate market, right? There's a lot of employers that are struggling to find qualified employees. Well, if they don't have to be in a particular location and they're allowing remote workers, now they have access to a greater candidate pool. So we're seeing more and more remote workers today. But with that can pose some real challenges to a group health plan in some situations. You may have network or carrier issues. So maybe it's a regional carrier that you're using, or Kaiser's a good example where it's only in some states, or you've got a national carrier that has a weak network in a certain area. So these remote workers working in multiple states can have a group health plan that just doesn't fit their need. The network is poor, the providers, aren't participating, or that carrier's not even in their area. So an ICHRA solution for this is to keep the group health plan. So let's say the company is based in Virginia, the corporate, and the group health plan will remain in Virginia. But that Ohio location that I've been talking about, they're going to offer ICHRA because maybe Virginia has the Kaiser health plan. Kaiser's not in Ohio, or at least I don't think it is, and they have no health plan available. So class out the Ohio group, give them an ICHRA solution. That means that
those employees can go on the individual market, on our off exchange, they can purchase their carrier of choice and also the carrier based on the network of choice that they have. So it's giving them that flexibility to purchase a plan that fits their needs that the group health plan is not. So you're keeping the group health plan, classing out a state or states, and opening up that individual market for those employees. Another renewal challenge, high turnover. High turnover isn't just a renewal challenge, it's like an ongoing administrative challenge, right? It causes a lot of additional administrative work, a lot of hours spent, more, enrollments, more terminations, more compliance, sending out multiple COBRA letters, ERISA documents. And two, with a higher turnover population, some of your other pre-tax advantage plans, like an HSA, an employer contributing to an HSA, doesn't make a lot of sense. It's not a great fit because the money, once it goes into the account and the employee leaves, it goes with the employee. Or in an FSA, where the employer must front the entire employee election in the beginning, if there's a large claim and then the employee leaves, they can't recoup that money. So high turnover can create some issues with maybe your go-to pre-tax advantage plans. So what's the solution for high turnover? Is terminate the group health plan and offer an ICHRA plan. Or if you can identify a group of individual where that high turnover is really happening. Let's say the Virginia location is pretty stable because it's, the Ohio market is pretty stable because maybe there's not as many job opportunities, all right? But the other state, regardless, is high turnover because they can go anywhere, right? The market is, there's a lot of employment opportunities, so there you have more job hoppers. Where maybe in Ohio, I'll stick to my example, in Ohio, there's not as many job opportunities, so you don't have as high turnover. So you've identified a particular area or a particular state where the turnover is high. So let's class them out. We'll class out the Ohio group. I don't mean to pick on Ohio so much, but let's pick on the Ohio group, choose them. That's where the turnover is really occurring, and we're going to class them out and offer an ICHRA solution. But in Virginia, corporate office, we're not seeing so much, or maybe keep the group health plan there. So wherever that turnover is happening, let's try to class it out and offer ICHRA, but still keep the group health plan. If it's just high turnover all across the board everywhere, maybe completely terminate the group health plan, do a full replacement of ICHRA. Large claims. So just this week alone, I've talked to 3 brokers that are being faced, we're starting to see the renewals for the larger groups. They're being faced with significant, and I mean significant renewals, 25, 35, 40% renewals because of large claims. So in that 50+ market, that employer is taking on some of the risk of the claims, right? It's not community rated completely. So a claim directly is affecting their renewal. And in all 3, it's really interesting, in all 3 of these conversations, it was really only one person, only one family that was driving up the claims, a high utilizer, a high claimant, okay? And because of that one person, the group as a whole is being faced with a significant 30% renewal with, family coverage being just unaffordable, absolutely, even for the higher wage earners. So we're going to look at the group again, and we're going to try to identify where that large claimant is and whether or not we can class out that large claimant. And I'll go back to the state, the geographic location as well, but it could be salary or hourly. I'll just stick to my example. And let's find out that large claimant, and again, is in Ohio, okay? And there's 10 people in Ohio. He's not the only person there, but you can class out that Ohio group. So now we have an Ohio classification, state classification, and offer ICHRA. So you're pulling out that high claimant from the group health plan and they're going out on the individual market, and now you've got, you know, the community absorbing that claim, if it makes sense, if the carrier and the network makes sense to do so. So all those 10 individuals in Ohio now have individual coverage available to them. You can't class out just that one high claimant. So they have the ICHRA, the employer's providing partial reimbursement for their individual coverage, and you've got the group health plan that's still in place. Large renewal kind of goes hand in hand, but I'm going to take a little bit different twist with this. And I'm not going to necessarily say it's one large claim and one large renewal, but it's consistently over time. Every year they're faced with renewals. And you may have had some clients that have been transparent with you and say, I want out of the insurance business. I am done. I can no longer absorb these renewal increases. My employees can no longer absorb the renewal increases, right? They're frustrated. You know, give me options here. Or I can only absorb a small part of it, and I know my employees can't absorb the rest of it. What are the options here? You may have, because of that, going back to my first example, because they can't afford it, now you have participation issues as well. So it can kind of be a combination of things going on. So with the ICHRA solution, you can terminate the group health plan and offer a full replacement of ICHRA. And this will allow the employees to purchase individual coverage on the market. Again, you can class out to manage the contribution structure. So you don't have to be consistent across the board, giving all the employees the same amount. And something else that I really haven't touched on, you can age band. This can be very effective to give equal buying power. So that older individual in the marketplace, we know that an insurance premium is going to be quite a bit higher than a lower income person. So by age banding, you can do different contributions within the different age bands to equal out that buying power. Okay, same with the classifications. You can kind of manage that contribution structure that it makes sense for what the employer is trying to accomplish. There's two things to keep in mind though. With the applicable large employers, you've got to make sure that the ICHRA contributions are still affordable. Okay, so they don't have the ACA penalty. And you also have to make sure those contributions are non-discriminatory. So within that age band, you've got that 3-to-1 ratio that you have, even though you vary it within age bands, that older person cannot get more than 3 times what that younger person. So you may be scratching your head saying to me, there is no way that I can keep all of this. There's no spreadsheet to manage, you know, the ICHRA contributions being affordable, then I've got to worry about non-discrimination, and then I have the state of Ohio and Virginia, and within Ohio and Virginia, I've got hourly and salary. Lisa, these are all great ideas in theory, but whew, you know, how do you even begin to manage this? This is where we want to introduce our tools and our solutions for you. These are very effective to model these different renewal scenarios that I just gave to you very quickly, real time, interactive with your client. So you may want to do some work with it before and present it to your client and massage it interactively with your client at the time that you're sitting down with them. Okay, so we're making this easy. The ICHRA conversation, the modeling, the deployment, a lot easier than what you would be doing if you were doing it manually or through spreadsheets. So we are getting you out of spreadsheets. No need to, you know, work with the spreadsheets if you have the Benefitbay broker portal. Okay. This real-time interactive software, you can sit down with your clients, you can go through various contribution arrangements based on their budget and also their philosophical approach to benefits, the salary, the hourly, the different classes that we talked about. The tool can be used, you know, for all of your groups and or all of the agents within your agency. Anybody can use the tool. There's no limits on how many different models that you can run. And I encourage you to run your groups through at renewal time, because then you can say, as I said in the beginning of the presentation, you may have missed that because of the audio issue, but model the ICHRA group. And if it's not a fit, say, hey, I modeled, I took a look at ICHRA. You may have heard about that, or maybe somebody had called you. There's companies out there that go directly to employers, ICHRA providers. So you're being proactive with the ICHRA conversation. And when I looked at it, it's not a fit for you because, and you can give them the reason. Or you could say, I looked at it and it may be a fit. So let me tell you what ICHRA is and what it can do. And let's take a look at the numbers and see if it's a fit for you. All right. Keeping in mind that our portal will not allow you to set up a group that is unaffordable. So large group, the real-time contribution modeling tool will keep you in compliance. There's guardrails. It will not let you set up a group that's unaffordable, and it will not let you set up those contributions that go out of that 3-to-1 ratio. So it's easy to do, and we've got you covered for that. For the small groups, we have a very unique tool that allows you to see what subsidies each employee may be eligible for. And then using this tool, you can create classes and make contributions unaffordable for some to allow them to waive out at ICHRA and access those subsidies, as I spoke about before. So classing out, for an example, this is commonly done. Hourly employees, you can look at the employees and know where you have to, it gives you a threshold, a baseline threshold of affordability and not affordable by employee. Then you can make contribution structure decisions based on who it needs to be unaffordable for. So you will be consulting with your clients on a prospective basis, the best case scenario fit for them, their budget, and again, what they're trying to accomplish. There's an easy, seamless employee shopping and enrollment experience online. If you want to manage that enrollment process, it certainly can be done through our portal. If you don't want anything to do with the individual market, many brokers tell us that, we can handle it for you, okay? So completely flexible in your delivery of that shopping and enrollment experience. So one of the challenges with ICHRAs that we've heard is great, the employer's helping them out, but the employees can't afford that monthly premium, submit for a reimbursement and wait for the money back. They just can't come up with that full amount for the month. So what we offer is what we call advanced reimbursement checking. This also is very unique to Benefitbay. It's a checking account that's provided to the employees in their name, and it's funded by the employer as an advancement for that monthly premium. And then when they're shopping, that bank account shows up and they're using that account number to purchase the premium. And then after they're done with that, the difference between either the ICHRA amount and what they purchased or the subsidy amount and what they purchased, so that difference, the employee responsibility of the premium, we will provide the employer with a payroll deduction report. So they can set up a payroll deduction pre-tax if it was through ICHRA, or post-tax if it was through the subsidy, and the employer sets up this payroll deduction so it feels very much like a group policy at that point, right? Under the group plan, my employer was paying for it, they were taking a payroll deduction. In our ICHRA solution, the same thing is happening. And then there's access to the data and the reporting. It's available to you, to the employer, and we actually have an employee portal too. So, it's not only easy to use, ongoing, they can see it. So here's an example that I want to show you where this is you've modeled a group and you said, gosh, for the group health plan that we're replacing on the individual market, it's more like the gold middle plan. So you see in the middle, top middle there, we've selected gold middle. And towards the left, under class, we've classed out hourly and salary employees. All right, so that's the modeling tool that we use. We don't have different states in this example, so we did hourly and salary. In the tool, you've uploaded the census and you've added the renewal information. You can show your employer for renewal, you are paying for the group health plan $11,500 a month, and your employees are paying about $8,000 a month. I've looked at an ICHRA plan, 11,500, 8,000. So that's the group renewal. I've looked at a plan called ICHRA, and I've classed out hourly and salary, and I've age banded. And this is what the ICHRA solution looks like. Now the employer amount is $7,600, we'll call it $7,700. So quite a difference between 11,500. And the employee amount is 7,000. So a savings there as well. So maybe an ICHRA could be a good solution for them. So you continue the conversation further because you've shown them where it does actually fit or work for that group. Now we're going to jump to the subsidy advantage. This is a small group, and we want to create in the hourly class an unaffordable ICHRA. So the contributions that we have in each class, the contributions that we are offering are unaffordable. So we're still looking at the gold middle plan like we did before. We still have the hourly and salary, but the difference is because it's unaffordable, we have now opened up almost $5,900 in subsidies that were not available to the employees if the ICHRA was affordable for everyone, or if you didn't offer an ICHRA and you were offering a group health plan. So why not take that government money and offset both the employees' portion and the employer's portion of the premium with the government subsidies? Pretty significant, right? $5,900. And these are real numbers, by the way. These are not fictitious numbers that we've made up. I think this group happens to be in Pennsylvania. So you would have your zip codes in your area pulling all that data. Let's go into the employer portal, what they see. So they will see the open enrollment, full visibility, who's enrolled, who's pending. They will see the funding arrangement, that banking arrangement that I talked about. I'll show you here in a minute. They have access to their payroll deduction reports, what they have to set up pre-tax and post-tax after open enrollment or after enrollment for new hires. There's a monthly reconciliation. So every month we look at the coverage that the employee has and we reconcile it with the bank account. Okay, we do that on behalf of the employer. So you can see we truly have this end-to-end support solution for the individual market, delivering an ICHRA very efficiently and very effectively. So this is a view, a snippet of the employer portal. You'll see in the top left-hand side where it shows the enrollment progress, not started, pending, completed, and in progress. You can click on that and get the names of the employees. And then on the bottom right, this is the checking amount. So based on the current census that was uploaded, the current enrollment, and based on that, that gold middle selection, the monthly premiums we're estimating to be $16,600. So the employer will put in the routing number and their account number, and that's going to fund this Benefitbay banking that each individual employee account is going to pull from. Now that individual employee account can only pay for the premium, okay? They can't use it for anything else. There's safety measures there. Now the employee not everybody may choose, the expensive gold plans. They may go bronze or silver. So this may be overfunding, and it probably is the first month. So what they will do is they'll just see in the current month any balance. So the difference, maybe it ended up only being $12,600. So they would see a $4,000 balance. So they simply just click add funds, and the funds will pull from the checking account number that they provided with the amount that they determined, and they don't have to do this monthly. They can fund it, quarterly or however their cash flow allows them or what they want to do, and they just will go in and add the funds. For the employee portal, so they're going to see what their employer ICHRA amount is, or that defined contribution amount is. It will give them direct access to the shopping and the enrollment experience, seeing what plans are available in their zip code and what they need to do. There's actually live support too. So we encourage them to use live support, especially when they're coming off a group health plan and they've never been in the individual market. Bring their providers that they're going to, their prescriptions, any kind of treatment, bring that to the conversation, and we can help really get a best fit solution for them. And again, you can choose to do the enrollment. It doesn't have to be us. It's up to you. Monthly employer premium payment advancement. So that banking account is available, will show up in their enrollment experience. And I'll show you a screenshot of that here in a minute. So it's accessible as they enroll. So they simply just put in the account and routing number. And then the pre-tax payroll deduction for the employee share of the premium will show. And once they've enrolled, they will have ongoing access to the employee portal, full access of their benefit information, the network, and so forth. So this is what the employee portal looks like. Here is the banking arrangement, kind of over to the right, First Premier Bank, their individual account number. And it says here in the enrollment summary that the employer is paying $195 towards their premium. If they click Enrollment Wizard, they go right into the enrollment process. After they've selected their plan, so they've gone back and forth, and that's all online again. But what I want to show, I'm not going to show that whole enrollment process. I want to show a subsidy advantage and what it looks like to the employee. It will show that the employer contribution, the ICHRA contribution for the month is $169. But there's $332 in government subsidy. It allows them to choose which one they want. If they choose the government subsidy, it automatically waives them out of the ICHRA. And below that, it shows that it is done on a post-tax basis, that payroll deduction between the subsidy and what they chose. But if they do choose the green amount, the ICHRA amount, the employer contribution of $169, it indicates that that will be taken out pre-tax through the payroll deductions. And the whole time that they're going through enrollment, this banking account will show that they simply enter that information, and they can set up the ACH for reoccurring payments so they don't have to go in each month and put in that account number. So easy not only for you deploying the ICHRA, but for the employees to manage it on an ongoing daily, monthly basis. So ending up here, just trying to conclude really best practice, what you need to think about. Benefitbay, we built an end-to-end solution. It spans across the modeling, the reporting, the payment process, the integrated banking, the user, the end user experience for the employee. We've made it simple, right? Analyze your book of business. Look at your at-risk employers, those that have told you, I can't afford it anymore, I'm done, or those that maybe you're concerned that they're not going to terminate their plan, but maybe somebody else will come in and BOR it. So your at-risk employers, your large group renewals, who's getting hit hard, your high claims. Look at all your small groups, open up that subsidy conversation and the potential there, lowering the employees and the employer costs. If you've got a group that has employees in several states, a really good ICHRA conversation to have. If you've got populations with hourly or salary, we see a significant number of those employers benefiting from the ICHRA because it does lower the employer and employee costs. Clients, you may have clients that you put MEC plans in place just to, satisfy ACA penalties. Well, if ICHRA can satisfy ACA mandates, the individual market could be a better option than those MEC plans. So revisit that conversation and offer them an alternative. If you've got a large group Medicare population, I haven't mentioned this yet, but premiums, ICHRAs can also pay for Medicare premiums. Those are your high utilizers on the group health plan. You can't class out just Medicare, population, but if they fall in a particular area, or if they're more hourly than salary, you know, if they fit into one of those groups, class them out, make ICHRA available. And some of the some of the industries that we have seen that benefit from ICHRA, and I'm sure this will expand as we continue, you know, what we're, you know, just kind of like a really 2 years into it, but really like a year into it. Professional services, nonprofits, retail, hospitalities, restaurants, construction, landscaping, tech companies is a really big one, and healthcare providers and services, home healthcare, nursing facilities, things like that. So look at your book of business, be proactive, have the conversation, reach out to us. I know, you know, we've given some really high level information, and that probably creates more questions, but we only have so much time. But we'd like to talk to you about your specific clients or your specific book of business, and showing you how ICHRA could be a solution for some of your clients. So as I said, as I wrap up here, we do have several questions that have come up, actually a lot of questions that have come up. So we will be reaching out to you and providing you answers to those questions. And I also encourage you, if you want to learn more about these tools and resources, and you're interested in getting into the ICHRA business or the ICHRA conversations with your clients, reach out to us. info@benefitbay.com is an email that you can use to reach out to us. Or if you go onto our website, there's a way to ask for more information, and we'll get back to you. Okay, so happy renewal season, happy open enrollment season. May you go through it successfully, as with at least less stress as possible, with hopefully some ICHRA solutions that will help your clients. Have a great day and a great rest of your week. Thanks.